What a jewel for Lafayette was this clinic. It was one of those secrets in Lafayette that most people aren't aware of.
The healthcare clinic was completely the brainchild of Dr. Terry Cromwell, and he was determined to provide services to people who were working and trying to help themselves but simply didn't have health insurance and couldn't afford the care they needed.
Everybody kind of bought into the idea of the Lafayette Community Healthcare Clinic, and it took a lot of civic-minded people to have that happen.
When they opened the clinic, it was something that was going to be sustaining through private donations. They didn't build Medicare, Medicaid. They got no governmental assistance at all, purely private donations to help those who were working very hard in Acadiana but simply weren't able to earn enough to afford insurance.
And all the dedicated people that were there, from the professionals all the way down to those that just occupied the desk. It was a lot of dedicated hours of free labor that went into operating the clinic. It was a community, really truly a community effort.
Community effort, yeah.
If there was no Lafayette Community Healthcare Clinic, there would have been a lot of working uninsured people that just could not afford health insurance that would have gone without, and especially, if I may say, without medicine.
I remember I had one 2-year-old little boy, who had a big tumor on his forehead and took it off, and it ended up being a melanoma. So he ended up at St. Jude's and did well. But that was one of those cases.
We had this very crusty nurse. She was hilarious. And she did triage on the patients that came in on Tuesday nights. And she happened to get this one patient, and they did their blood pressure. They did all the workup before the doctors got there. And when the patient got up to walk away, she noticed that the patient was walking kind of funny. And she stood up and she said, wait, sit down. You're walking funny. She said, I think you're going to have a stroke. And the lady looked at her and, what? And they called, we had, again, Acadian ambulance helped us out with our patients. We called Acadian ambulance, got her to the hospital. She was within minutes of having a stroke.
During my time there, and as well as the other volunteers, we had cancer diagnosed. We had chronic kidney disease diagnosed, acute kidney failure diagnosed. There were some critical patients in there at different times, but the majority of the patients were there to maintain their health so they would not end up in our emergency rooms.
When Governor John Bell Edwards signed his executive order to expand Medicaid in Louisiana, we knew, the board knew, and the staff knew that the clinic was coming to an end.
Well, I certainly thank him for giving this community an institution, really, that helped the poor people in our community.
I would like to thank Dr. Cromwell for the vision, the support. For 10 years, he was my board chair, and I don't think I've ever worked with anyone who was more caring, more giving, more supportive, and I couldn't have done it without him.
In life, we accomplish things, and we've accomplished this. We had a mission, we fulfilled our mission. So, even though we're all sad to see it end, all good things do come to an end. And in this case, it has a good ending. And that was, again, I go back to my earlier comments, that was Dr. Cromwell.